And welcome, everybody. We are out on Twitter Spaces to take your calls. I'm, of course, watching you over on the Restream and the Rumble Rants as well. But today it's sort of AMA. Ask me anything, whatever you're interested in. We'll get to it. I've got some things on my mind as well. And I'm sure Susan has some ideas about what she wants to talk about, like how it's like to struggle with an airline that's not very responsive. Is that what you're doing right now, Susan? She can't even hear me.
No, I'm dealing with triplets flying to Portugal, and I've been doing airlines for the last 24 hours.
Unresponsive airlines.
No, I found it. He just, your son is looking.
Travel is your jam.
He may be able to play Rachmaninoff on the piano and run a business, but he can't find a seat on a Swiss Air.
Well, I actually am sympathetic to that because I can't do that either.
I know, it's true. He got it from you.
All right, we're all here. We'll get out your calls. We're on Twitter Spaces. Just raise your hand there, and I'll bring you on up. You'll be streaming out on multiple platforms, wherever you can find us, which is Rumble and Twitter and Twitch and Facebook and YouTube, the usual places. But I'm interested in your questions today. There's a lot to debrief on for the last couple of weeks. Let's get to it.
Our laws, as it pertains to substances, are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want to help stop it, I can help. I got a lot to say. I got a lot more to say.
Hey, you guys, I just came from 2 hours with Mark Garagos, where he was sitting in for Adam Carolla for me on the Adam and Drew show. And very interesting hearing his thoughts about so many of the things that are going on today. We all share the same concerns. There are so many excesses that are going on and so many things that need explication and explanation that are going unexplained. I made the mistake, it wasn't a mistake. I essentially, I think I retweeted something somebody said about the excess deaths in Western countries, and I merely made the comment that this is something we need to explain, which is the case. If you listen to me and Dr. Malhotra, the cardiologist from UK, we were reporting many of the clinical things we were seeing and the complete lack of response from the scientific community, from the government regulation agencies, from the epidemiology community. What's causing this? Where is it coming from? Who's doing the studies? What are the studies underway? What are the preliminary preprints? What are we looking at? And it just looks like they're looking at nothing. They're literally, we are seeing data that suggests excess deaths. If you look at the Ethical Skeptic or Alex Berenson, the data looks pretty scary. And today, John Campbell on his YouTube stream essentially was looking at the same data, just shaking his head. Why are we hearing nothing? Why isn't anybody in the press asking a question about what this data means? It's all non-COVID death. Now, it could be we're getting the denominator wrong, that we're anticipating a lower level of excess death than we should be. This is what Dr. Vinay Prasad pointed out to us, that perhaps our model is not correct. Or maybe this is some residual of COVID, or this is related to long COVID, or it's related to lockdown, or it's related to the mental health crisis we are in, or it's related to the vaccine, or it's all of the above. But somebody needs to begin to look at these questions and at least ask the question. At least ask the question, A, are we really seeing excess deaths, yes or no? If so, what are the likely culprits and what is our evidence for that? I was just listening before the mics heated up to Michael Crichton back in 2007. He was a physician, famous writer, he wrote and directed movies and wrote Jurassic Park and that kind of stuff. And he was saying in 2007 how mysterious it was for him that people seem more interested in consensus than in evidence. And he reminded us that the history of the Nazi regime was the Nazi scientists all got together and said, Einstein didn't know what he was talking about. That's our consensus. And again, we need proof. Unfortunately, I think the post-structuralist infection has gotten under our skin, where the idea of proof is something anathema, something old-fashioned. We have to have proof for things, and the proof has to be good, has to withstand scrutiny, and by the way, dialogue and debate about it. So my little tweet that just said, hey, we got to explain this. There's Dr. John Campbell today shaking his head, just going, I don't understand. It was like a 20-minute video. It was very short. And his question was, why isn't somebody asking this question? It looks like a horrible event is underway. It looks like the deaths are higher than with COVID. What's going on? What are we looking at here? Is there an error in our data, or is there something really going on? I can tell you, if you listen to me and Dr. Malhotra, you will hear very good conversation about the cardiological effects, which have been well substantiated. The problem is, I think we're about a year behind on our data, and the clinical situation where we're seeing tons of problems with supraventricular arrhythmias of various types, possibly some increase in sudden death in young people. I think that data is behind. I don't think we have that data caught up yet. And again, if you are someone out there, particularly young males, that suddenly developed rapid heart rhythms, particularly very heart rhythms. So supraventricular tachycardias are rhythms that are generated from the top of the heart, the atria. Not that uncommon in young adulthood, but usually they are in the range of 150 to 170 in terms of rate. I have noticed in these ones that seem vaccine related, the rate is around 240, which is unusual. And a supraventricular rate of 240 can deteriorate into a more dangerous rhythm associated with sudden death. So this is really serious stuff. We saw a lot of POTS. We saw people passing out. And by the way, it appears to be more associated with boostering than with the initial, as much concern as there was with the initial series. The boostering seems to even have more of this, according to the data. And again, if not, and one of the questions that needs to be answered is this worse than from COVID itself, right? COVID clearly has end organ problems, had problems with cardiology, with your heart, with your brain, endothelial problems. I've been saying forever that there's something about this disease that affects the lining of the arteries. Seems that the vaccines may be doing something similar. What's the relative risk of one setting versus the other? If somebody who's 30 years old and seems to get no moderate COVID, no serious COVID, no complications from COVID, those are the ones we are making sick with a vaccine. Maybe we want to think about where we target our vaccine therapies. And of course, as I mentioned yesterday, because of AB 2098 in California, we can't discuss this with our patients because any discussion deviates from the standard of care as laid out in the law by AB 2098. Now, I've said before here that I've talked to the board and I've tried to create a common ground with them and help everyone understand each other. It's still very difficult to get them to understand what a complaint does to a physician, how it destroys his or her life for periods of time, that being an outlier is not the issue. Nuisance complaints is the issue that destroys people's lives. Of course, if you're an outlier, you should be disciplined by the board. Of course, it goes without saying. Everyone in my profession wants quality physicians to be the ones that are interacting with the public. But nobody, as Dr. Victory pointed out yesterday, should be more frightened than patients when physicians are being forbidden from discussing risk reward and full informed consent if, in their opinion, the doctor's opinion, it flies in the face somewhat of the standard of care and then runs afoul of 2098. It really is kind of an extraordinary time. I feel like we're in the upside down all the time. And as I said, I was with Mr. Mark Garagos for a couple hours, and he had a very similar sort of feeling about things from the standpoint of the legal system. Oh, you want the Crichton interview? I will get it to you.
Yeah, you can do it after. I'll add it to the website so when people are looking for it.
I don't know. I'm going to email it to you right now. I don't know why I got to it. I don't remember if somebody recommended it to me or why it was something that I started listening, but I've found myself listening to it repeatedly and just thinking, wow, this thing, it was all the way back then, people had concerns about this. And now I think Dr. Crichton is gone now, but is Michael Crichton passed away? Is that true? Am I correct about that? Can somebody help me on that?
I think so. I'm looking at
Restream. Yeah, maybe you can help me with that.
Yes, in 2008.
I forget what he. Yeah.
Let's start a rumor.
No, I thought he had. And it was right after that conversation, which is interesting.
Did you hear there's a rumor that Trump
after he
was dead?
sold 200 million books?
Yeah, not a bad career, I got to say. And he was talking about how he made predictions in some of these books 40 years earlier, and how he's able to look back and sort of assess himself, like how close was I to being accurate? Can I still stand by my opinions? Things change. Things do change. All right, so I want to get to your calls. Got a lot of you up there with your hands up. Let's get right to it.
Say hi to people on Getter.
Oh, Getter. Hi,
and
guys.
Twitter.
Getter.
We can't see your remarks.
Hello?
1 second, sir.
We can't see your remarks on our restream, but we do know you're there.
But we can see them over on Rumble.
Rumble and YouTube.
And
Facebook. And Twitch.
Oh my God.
Sorry, I didn't mean to interrupt you.
I'm just looking at the Rumble guys, and they're just perpetuating all kinds of weird theories. So please, guys, get your facts. Get the facts out there.
If I see anything good on Getter, I'll let you know.
Molten Sod said, isn't 240 higher than being very active? Yes. When you get over 150 molten salt, you're no longer in the range of physiological rhythm. Above 150, you're into pathological rhythms, generally speaking. Though you can have an atrial flutter that's lower than that, things like that. But even atrial fib can be lower. But in terms of determining something to be a rapid rhythm that's a problem, over 150 is sort of an interesting threshold. Yes, sir. What's going on?
Hey, Dr. Daddy. How you doing? Thanks for taking my call.
You bet.
So I feel like it's kind of serendipitous that you selected me, because with all of this talk about heart issues and that sort of thing, it kind of relates to my condition. I called a few weeks ago. I was telling you about Lyme disease and how I had that.
Yeah.
And I had end-stage Lyme, and I had a heart arrhythmia, which was associated with Lyme carditis. Mm-hmm. So what I want to ask you is, what's the difference between Lyme carditis and myocarditis?
Lyme, I think you're maybe misquoting the term. It would be Lyme myocarditis. Any inflammation of heart muscle is called myocarditis. So it is what causes the myocarditis. Viral myocarditis, Lyme myocarditis, the Echinococcus myocarditis, whatever. There's all kinds of things you can get that cause myocarditis.
Mm-hmm. Okay. Yeah. It just, all of this has me wondering if I dodged a bullet, because like I said before, I was apprehensive about, taking the shot. And I just wonder if I might have ended up becoming one of these statistics sometimes.
I hope not. Myocarditis is a serious thing. As I've said repeatedly on the stream, before the vaccine days, myocarditis was a rare emergency for two reasons. A, you could suddenly get a deteriorating rhythm or heart failure. And down the road months, you can end up with needing a cardiac transplant. The muscle can just fail. And we don't know how to predict one versus you can't look at the muscle and predict. I mean, obviously, if there's a lot of inflammation, you worry you're going to get a worse outcome. Thank you, buddy. I'm glad you are better and that you've remained well. Let's talk to, whoops, what's happening here? This is the Batch Tube. The Batch.
Hi, Guy.
Hi, Guy.
So I actually called about a month ago and briefly talked about my thesis with
the thesis with what? I'm sorry?
Black hole stuff.
I missed what you said. Thesis with?
Oh, with the black hole stuff. The black hole.
I don't remember.
Not the butthole, the black hole.
The black hole. But
yeah,
I remember that vaguely.
Yeah. Well, anyway. Thank you, Susan.
You're welcome.
So I found out recently the professor that was my advisor is in need of a kidney.
Oh.
And I'm wondering if I can promote his website on here by chance.
Yeah, sure. Why not?
Yeah, I don't know what that accomplishes, right? You can't direct your kidney, can you? I guess you can. Yeah, you can say you can give a kidney to somebody. Yeah, so I guess you can. So what is it?
It's kidney4scott.com.
Okay. Pretty simple.
That's nice.
If somebody, that would have to be somebody willing to give up their kidney, right?
Yep, and I'm just hoping for him. He's a great guy. So,
all right, man.
My daughter's giving her
maybe we get a bigger audience.
We'll give it a shot. Send it out there. Kidney4scott.com. This is Jalal, I think, if I get this name right. Hey, Jalal. We got you up there. I'm going to maybe pull you down if we... Oh, you got to unmute your...
It's just a little leg and then the mute button.
There you go. The mute button. Yeah, it's weird how
it's on now.
The mute thing comes on after they get pulled up. It's very weird.
I don't know.
So as a microphone in the lower left-hand
Elon
corner, you
needs
got to pay
fix it.
attention to that. Yes, Elon. First order of business. And if my $8 a month is going to go to something, I want it to go to this.
Yes.
All right, I'm going to have to take him down.
Well, come back later, Jalal. You'll figure it out.
Okay, this is Logan. Okay. By the way, Logan, you got to unmute the mic. Don't forget.
Come on, Logan.
The other thing.
Oh, dang, that was fast. Hey, sorry, I didn't realize you had accepted me so fast.
There, you came up on my thread. You came up quickly on my thread, so I just pushed. Go ahead.
Yeah, so I asked once before, like, what you thought about what would happen if disclosure ever happened, but here we have like they're coming out with like the UFO report for this year that they're second year in a row, right? So I just wanted to know kind of what you thought might be disclosed with the new UFO report and how that might affect population if they go ahead and say aliens are here.
Yeah, I don't I hope they're here. I think it'd be fun. But
for the record, I don't think they'll ever say that.
Yeah, I don't see the evidence that there's gonna be much to this. I'd be surprised, but I'm prepared to be.
I mean, just hypothetically, if they did.
So I don't even know the spectrum of what they could tell us. I mean, are they going to tell us that there's a bacterium that they think came in an asteroid? Are they going to tell us that there is someone who, like there's a consciousness around us and he visits my house?
Just that they're like observing us, like in the sky, like, and we don't know like their motivations, but they're just observing us, and they seem to be friendly, maybe, but we don't know.
So, all right. So I'm gonna go on pure fantasy speculation ride with you. Okay, I'm just gonna riff on this just to see if you want me to do that. He's giving me a heart. I like that movie. Was it Contact with Jodie Foster? Logan, is that the one where she goes into a parallel kind of universe, so to speak? I don't know how else to describe it. Like almost a time-space alteration. You know what I'm talking about?
Where like they build like the machine from the future, and like they go to the star Vega, and she like talks with her deceased father. Exactly.
That to me was interesting. I don't know that it's the closest thing to reality, but I like the fact that they took it away from this idea of saucers landing on the ground. I like the idea that, for instance, perhaps we're a hologram. Right? I try to figure out why is it that the thing that's most mysterious in the universe for me is electron entanglement. Do you know what I'm talking about by electron entanglement?
Oh, yeah.
Okay. So entanglement for the rest of you is if I do a quantum measurement on the spin of an electron in this pen, and then I do another quantum measurement on an electron and a star 5 light years away, these two electrons will be entangled. They will affect each other through time and space by ways we have no fucking idea how it happens. So the only way...
Spooky action at a distance.
Spooky action at a distance is what Einstein called it. It's exactly right. And one of the ways I can make sense of it, we have a limited instrument up here, right? So part of what my theory would be, Logan, is that whatever this is that we don't see, that we're missing, it's probably not something that we were exposed to in our evolutionary heritage and had no evolutionary function in terms of our survival. Therefore, we didn't develop the capacity to really know it or pay attention to it or find it. Okay? So I'm going to say a combination of the weakness of this instrument in terms of what its purpose was, which was causing Homo sapiens to get to another generation. That's the sole purpose of this thing. That's why this thing evolved. This amazing, one of the most complicated instruments of nature evolved to get this species forward in time. That's it. That's what we developed for. So lots of things we don't know, lots of things we don't see. It's amazing we have been able to deconstruct and understand things using methodologies, not our sensory function so much anymore, but methodologies to penetrate the physical reality. And spooky action at a distance suggests to me that space-time may be a artifact. It may not really exist. And it may be an artifact of us essentially being kind of a holographic representation of what's really going on. And we haven't penetrated yet what's really going on. And somebody somewhere, and by somebody, I'm not even using the term correctly, something somewhere, something or other, may have greater capacity and see us doing what we're doing or whatever, or be able to move in and out of our hologram or something. As Heidegger and people who studied Heidegger used to say, it's something that's something about something that's something. It's like we can't describe it. So I prefer to kind of keep it there. And because it doesn't have pragmatic utility for me, that's why I don't spend a lot of time thinking about it. Logan, what do you think about that?
I think that's I'm impressed how much you know about that. Actually, you're really pretty smart, like well-rounded, and I think you're totally right.
Well, I've been because I've been ruminating about quantum entanglement for a long time. These thoughts occur to me. I've never said them out loud till just now, and I don't think I've ever said them in my own head in a linear sequence like that. And I have no idea if it's anything, but I don't know that it's not. So there you go. So I hope that, Logan, that whatever they give you moves us forward in our understanding of this. Okay?
Thanks, brother. I appreciate it.
All right, man. Thank you. That was fun.
Good for you.
Good for him or good for me?
Somebody just mentioned the Truman Show. Were you on the Truman Show, or was it?
No, I was in the one with Woody Harrelson.
Yeah, I can't remember the name of it.
Yeah, where he was also on a TV show all the time. So.
Yeah.
But I was on it with Bill Maher.
Yeah.
Yeah. So
how weird is
Have you
that?
ever encountered anyone that has the Truman Show diagnosis where they actually believe that the whole world revolves around, like it's called that for that reason, because they actually believe that they're in a similar state where they're the main character of
being watched.
I mean,
world.
psychotic patients will have similar kinds of beliefs. I was talking to Garagos about this today, and that what people don't understand is that thinking is the problem in mental illness. Thinking is what becomes disturbed and distorted in very specific but often subtle ways. And people don't understand when they're hearing it. Humbly, I thought of this when I was listening to Ye on Lex Friedman's podcast. I thought, oh goodness, there it is. And this poor man, I'll back that guy, needs to get help with that so he doesn't say these things that get him in such trouble. Because the thinking gets off when your brain has certain conditions. The classic thing is denial with drug addicts, right? That's a biological process in the brain that's off. They can't see what's happening to them. They deny what's happening. They minimize it. I think a lot of people understand what denial is, but there are things like that operate in all mental illnesses. And the thing that is the most problematic in most illnesses is the thinking. They start thinking certain things are good ideas, or thinking things that are happening, or believing special insights and special abilities. And that's all a thought problem. That's a thought problem. All right. So let's talk to Tell Me No Lies. Get that person up here.
Sorry.
There you
My
are.
mic was off.
There you are.
So sorry.
You bet.
Hey, Drew.
Hey.
Hi, Susan.
Wow.
So here's an update. I'm sure you remember we talked about the withdrawal, toxic withdrawal of the SSRI, Cymbalta.
Yes. And you were having
couple of weeks ago.
You were having the zaps and misery and all. You sound better. You sound better now.
I am better. I am not free of it, but I'm now functioning with it.
Did they give you anything to help?
Nope.
It gets better. It can take up to, I don't want to tell you how long, but it does get better.
Don't depress me. I already read all that.
Yeah.
It could take 6 months. It could take
Easy.
6 years. There's just no way to know.
6 years is weird. 1 year is common. 6 months is also common though. So hopefully it'll be a 6-monther.
I hope it's less.
Yeah.
But here's the so I went on nothing.
Yeah.
I didn't reinstate the Cymbalta, so I didn't retitrate down because I didn't want to risk serotonin syndrome, so I skipped that.
Not likely. But didn't we talk about cyproheptadine and other sorts of medicines?
I think we did, but I never heard back from my doctor, and I sent my doctor a message the same day.
Okay.
So I never got a message back. I never got a return returned. But here's the other thing that I've been dealing with for over a year. And so this is obviously not a withdrawal symptom, but it's an actually involved symptom, is the serotonin. What is it? It's the PSSD.
Mm-hmm.
The sexual dysfunction.
Yes. What about
side effect that goes with the? Okay, so hello.
All right. So what
do you do about that?
That's distressing, right? And so SSRIs and NSRIs can cause decreased libido, orgasmic function problems, all that kind of good stuff. For years, I used to fight with the drug companies. They denied it happened. It made me crazy. I helped out on a campaign with Burroughs Welcome to try to raise awareness about that, and that ended up being a nightmare because that company got busted making recommendations for off-label use of medications. And but at the time, I was very proud of the campaign that me, the psychiatrist, and the gynecologist were doing, was try to raise awareness about this. And the thing that has become increasingly aware in recent years is that some of these people that develop these sexual side effects from these medications have them permanently. Now, it's a small number. It's a small number. It's not a common thing. Thank you for saying that. And it often resolves. And I got to tell you, if you're already so miserable with the withdrawal syndrome, I mean, people in withdrawal don't have good sexual functioning. You know what I'm saying?
Of course not.
Yeah. So I think this is more about that.
Well, here's the thing is that while I was still on Cymbalta, I noticed my libido being killed.
Right.
So this was just. I'm now off everything.
Good.
I shouldn't admit this, but I cold turkeyed off Wellbutrin too.
Good.
I was on 300 milligrams.
When people start getting, I'm not telling you what to do, and you're not my patient. I don't know what's going on with you. But I must tell you, when people get into complicated situations, and I will just say my own personal experience of this, when people get into complicated situations, both in terms of withdrawal or side effects, and they want to stop everything, I'm sort of relieved. I feel like you're not going to make things worse by doing that. You may get through some miserable experiences, but you're not going to make the overall syndrome worse in all likelihood.
Yeah, that was the chance that I took, and my 22-year-old daughter was taking Wellbutrin too, and she went on it because she got really depressed during COVID and being locked in.
Of course.
And she's an introvert, so the fact that she's depressed, not being able to go to school, is really
terrible,
depressing.
Terrible.
Yeah, so she ran out of her medication and she stopped taking it, and I said, "Do not go back on it. Do not."
Well. Again, always be careful, because we don't know what she might have told her doctor with the door closed in terms of who knows what that they're treating. And so you don't want to be the doctor, but you want to say, I would urge you to say something like, "Boy, it's a great relief to me because I've had side effects." Make sure you check in with your doctor. Just make sure.
Well, here's the thing, is she said, "I don't even know I was still on it because I wasn't even, now that I'm back in school and I'm back in class," and she's away at school. She goes, "I'm not depressed anymore."
It's all good. Don't get me wrong. I'm relieved too that she's off.
Hooray for that.
But
right?
Patients and families shouldn't be making therapeutic decisions. I'm just saying she can fight off her doctor if she wants to stay off it, but at least report to that person. Just send an email. Go ahead. Just want you to know.
Did her hair fall out?
Yes.
Yeah, mine did too.
Wellbutrin does that.
I always have that problem.
What? Oh my God, I think we found the missing link. She could not, but you know what? Wait, I take it back. Her hair was thinning while she was on it, and she cannot get that thickness back. And we have really thick hair in my family.
It'll come back.
Yeah, it'll come back. Get the Rogaine going sometimes. There are things. There's
For a 22-year-old, you do Rogaine, really?
Sure. Nutrafol.
It'll come back.
Yeah, there's stuff to help bring it back.
It comes back a half an inch a month, okay? So you'll see little tiny baby hairs coming in.
Oh, okay. I'll tell her about that.
It happens with your hormones.
I've got lots of folks I got to get to. I appreciate
I know you have
calling.
a lot of people. So what do I do at the PSSD? Do I just have to deal with it until it's over?
Yes. But, I mean, look, you're asking me for treatment advice. I can't do that. But I can tell you that I would not expect your full sexual function to come back until the withdrawal was sort of really subsided. Okay.
And then maybe I'll notice a change in the side effect from being on it.
Yeah. Yeah. And
so maybe
I would, get your engine started again. See what's, see what stimulates you and what you can get things kind of going. Because it sort of has momentum to it.
Yeah, because I still feel fluey. Isn't that? I got really great. I had like a few good days where I wasn't feeling like I had the flu anymore, and then it came back. And I saw this. I'm going to put this on. I'm going to post this and tag you tag you. And the symptoms are. I went, oh my God, that's everything. It's like everything.
Yep.
And so maybe it'll help some other listeners. I don't know, but I understand you're not giving me any medical advice. So, but I think it's really important that people know that this is not made up, and it's not in anybody's head here. It's real. This shit is real.
Got it.
Thank you, Drew.
Okay.
I appreciate it.
So thank you. So I have to, so the Restream is bringing up this, what they're calling JSK and Wellbutrin. So I'll explain again what happened with what at the time was called Welcome and then Burroughs Wellcome, which is a company that made a medication called Wellbutrin at the time. They hired me and a couple of psychologists and a psychiatrist and a gynecologist to educate people about the side effects of SSRIs. That was the campaign. I had seen people's lives and relationships destroyed by exactly what's happening to our last caller, which is they developed these sexual side effects, and I was delighted to be a part of that campaign. It was not a Wellbutrin campaign.
He didn't make a lot of money either.
It was not a campaign, hey, use Wellbutrin. But occasionally people asked me, what do you do in your practice? What do you do in your practice when somebody developed these side effects? At that time, I would either stop the medicine or I would switch to something that didn't cause a sexual side effect. And there were 3 medicines I used at that time. That was Cerazone, which is a good medicine.
But that had to go off the market for some reason.
Took it off the market because of liver inflammation.
I was taking it.
Wellbutrin and, oh gosh darn it, mirtazapine. The nighttime medication. I would use one of those 3 medications, or sometimes I'd add Wellbutrin. And I would answer that when people would ask me that. Amongst this campaign, which we did all over the country, I would answer that honestly. That's how I'm totally entitled to answer that. Apparently, one time when I answered it on a radio show or something,
on K-Rock.
No, I don't know where it was, but I didn't say, oh, by the way, I took a stipend from this company and and blah blah blah.
Right, you're their sponsor.
I forgot, which I can't believe I forgot, but I guess I forgot to give my disclosures.
It was K-Rock. It was 3 a.m.
Well, maybe, but you're supposed to always give disclosures when you talk about medication if you're accepting any kind of stipend. And that was not Glaxo. That was not SmithKline. It was called Burroughs Wellcome back then. It was way long before SmithKline and those companies came in. Those companies did come in, and apparently they had a habit of promoting off-label use of medication. So you don't even understand what the problem was, people who want to take issue with this. The problem was that company was urging doctors to use their inhalers primarily off-label. That's against the law. So when I talked about my practice of an off-label use on a medicine, which I'm totally at my liberty to discuss wherever, whenever I want, I left out the full disclosure, which is the massive error on my part.
But there was a lawsuit. You're in the middle of it.
That's why I got named in that lawsuit.
So I want to give it.
Not because I accepted money to go educate from them, not because I was promoting Wellbutrin, because I left out. I still can't even believe I did it, but I guess I left out when I was discussing these use of medication to avoid sexual side effect, what I do in my practice, and oh, by the way, one of those medicines.
It was another cancel culture situation before anybody knew what that was.
Yep.
Hey, thanks Julius Agnos for the $2 super chat on YouTube. We appreciate it. He just wanted to let you know that Carl Sagan wrote the novel Contact.
Oh, really? That's interesting.
He was giving us his knowledge, and we missed it, but.
And also, yes, Remeron is mirtazapine. Thank you for that.
Get Drew off his rant.
Well, no, I get very.
I was there. It was BS.
I get upset because it was a campaign that was extremely good. It was helping get people off SSRIs, much like that last caller.
But you had your first case of cancel
culture, and people didn't even, as always, it was never what I did is what they said I did, which was not what I did. What I did was an error in disclosure. That was my error. not an error in promoting.
I went with
getting
you
off
on all those
SSRIs.
tours. There were a lot of depressed people in those audiences. It was
and
really
whose relationships
good
were
information.
getting totally messed
Oh,
up.
it
by
was like really
SSRIs.
sad to see, but
Yeah. Well, remember
we
we
went
had
all
John,
over the country.
We had that guy wrote the book Men Are From Mars, Women Are
Yeah.
From Venus with us. We had all these different people
John
with us.
Gray.
Yeah, John Gray
That guy
was with
was
us.
a trip.
But we had all these
We went
people
to New
trying
York, we
to
went to
talk about the importance of relationships.
We went to some big
and
cities.
how medication get in the way of that. That was the campaign.
We got paid nothing.
And people
but-
don't even know what.
And you
what
did it
that
for
was.
like 2 years.
Yeah.
They made it sound like you made $10 million in the lawsuit.
No,
you know?
the other doctors were made a lot.
They were
more
making the
than
money,
me,
but
yeah.
you just got a mention and you got wrapped.
Well,
into the whole
I
thing.
made a mistake. I made a mistake.
Yeah, but you
And,
weren't one of the people that took millions of dollars.
No.
You know,
No.
I think you.
So again, those of you that want to say that I was a shill for Wellbutrin, I was not. I
He
was
wasn't.
talking about getting people off antidepressants, much like our last caller, and I made an error. That's on me. I didn't disclose where I normally do, and I didn't, I guess.
Have
'cause
you
I
ever
was telling-
talked about this anywhere else?
Million times.
Okay.
Million times.
Over
Yeah, he's
here.
talked about it on the show a bunch of
I-
times. Yeah.
Yeah.
He's talked about it here.
Every time it comes up.
I think something that also
Yeah, go
needs
ahead.
to be pointed out is that this happened. This was something about at least 10 years ago, if I remember correctly, when this all
Dude,
happened. And
1997.
Oh wow, even further. Okay, so the
Nin-
article I read was 10 years
the
old.
article, the lawsuit was in 2000 something, 2015 or
20
something.
years ago.
But my campaign was 1997 and 1998.
5 years ago.
Almost 30 years ago. 30 years ago.
No.
I think
No,
of this
we
more
were-
Three
as
years, it will be 30
Well,
years
we-
ago.
Yeah, we were married.
I think of
I
this
guess you're
more
right.
as
It's
this. It
25.
seems like that you have someone should have consulted you and walked you through this, because back then I remember, especially influencers did not understand that people had to give these sort of disclosures, FTC disclosures. In fact, just like a few weeks ago, Kim Kardashian got fined by the FTC over $1 million because she didn't put the correct FTC disclosures, and they're really tight about that. Back then, it wasn't very clear. You didn't have to be clear in TV shows that the Ford.
You know
that was
what?
in
You're
the
right. It was
show-
Lucy or it was Lucy
very
or
different.
Goosier then, but we didn't look at it as a legal standard. We looked at it as an ethical standard.
Right, exactly.
And so it got confusing. I think I'm trying to reconstruct it in my mind. It was 30 years ago. that a quarter a century ago, everybody, a quarter century. Let's think about this. So I think in my mind, I must have been thinking, hey, I'm just telling them what I do in my practice. Why do I need to disclose? It's just what I do.
Right.
But you do need to disclose when you mention a medication that you're entitled to mention, entitled to use, entitled to talk about.
It kind of
but you gotta
stopped the whole
disclose.
drug company using doctors as promotion.
Well, no,
after
that was all. See, that's the
Isn't
whole
it?
point. Now, I don't think we would work with a big pharma company like that. We just wouldn't do it because it doesn't. It does. It's not,
We
it's-
haven't
it's
ever had
exactly
an
what-
ad from Big Pharma in all your shows you've ever done because of that.
We have worked with small pharma companies
Nothing,
though, that I think
though.
have really important tasks that they're trying
No,
to
we
pull out.
passed on most of everything.
But that we are, but the big pharma. This is what we were talking about with RFK, right? It's what we were talking about with Robert Kennedy, with the coziness of these relationships and the confusion of where money goes here and there. That's what you don't want to be a part of, and that's what I'm trying to stay out of. So
You always have.
I've got a bunch of calls.
For 25
I'm gonna get to.
years.
I see some of you that have been on hold a long time. I'm going to get right to you after this break. Consumer price index yet again going up. Stock market in turmoil. What's our government doing to quell the surge of inflation that is gutting American families? Oh yeah, they're spending more money and adding to the burden. Don't bury your head in the sand while your savings get decimated. It's time to do something about this. Visit birchgold.com/Drew. Now, I don't give investment advice, but you can visit birchgold, BIRCH, gold.com/Drew. Birch Gold will send you a free info kit on protecting your savings with gold in a tax-sheltered account. Great people with almost 20 years of experience converting IRAs and 401ks into precious metals IRAs. Don't let your savings lose value. Visit birchgold.com/Drew and claim your free, no obligation info kit from Birch Gold. You can own physical gold and silver in a tax-sheltered retirement account, and Birch Gold will help you do it. Birch Gold has an A+ rating with the Better Business Bureau, countless 5-star reviews, and thousands of satisfied customers. Check them out now. Visit birchgold.com/Drew and secure your future with gold. Do it now. For a long time, I've been talking about the holy grail of skincare, Genucel, and the amazing results that both Susan and I have seen. I'm a big fan of Genucel's Silky Smooth XV. It's a moisturizer soaked right into my skin instantly, and with its immediate effects, I saw fine lines and wrinkles visibly disappear within 12 hours. Susan loves Genucel's vitamin C serum, infused with the purest vitamin C, absorbs to the deepest layer of the skin thanks to Genucel's proprietary skincare technology.
I am a snob when it comes to using products on my face. The dermatologist makes a ton of money from me. But when I was introduced to Genucel, I was so happy because it's so affordable and it works great. I was introduced to the Ultra Retinol Cream, which I love at night. All the eye creams are amazing. People notice my skin all the time, and I'm so excited because it's actually working.
And right now, Genucel has bundled my favorite products and Susan's for you to try today for up to 60% off retail pricing. That's right. Save up to 60% on my favorite Genucel products today. Just go to Genucel.com/Drew to see what's in our bundles and receive an extra 10% off at checkout when you enroll in their personal concierge at checkout. That again is Genucel.com/Drew, GENUCEL.com/DREW. All right, we're back. Get right to these calls. I know a lot of you have been on hold for quite a while. Let me get Chris up here. I will get to you guys today. I think I'm going to get to most everybody.
Yeah.
Chris, what's going on? Yeah, I think.
Hello.
Hey there.
I did not expect to be speaking with you. I'm a registered respiratory therapist and don't have anything to speak about the COVID or vaccines because we all know what's going on there. I have a question for you personally, Dr. Drew. I watched Dennis Rodman on your show, and now he is on The Surreal Life, and wanted to see if you had seen his recent behavior and your opinion on what's going on.
I have not watched what's going on. I would be very cautious about drawing conclusion from what goes on in a reality show because I don't know what the producers are doing to encourage some of this stuff. However, I no longer treat Dennis. Dennis and I, however, are friends. And he knows my concerns about him, and I have lots of them. And I care.
He is drinking alcohol like water.
Yeah. And
just
so,
like
and
always.
Again, I don't want to, how can we manage this in a way that's still honest? I don't want to divulge any confidences, but he knows I know, and he knows I'm concerned, and he does very well for periods of time, and then he doesn't. And that's the way some people are with their condition. I wish for everybody. I wish for everybody to get it and stay with it, but it doesn't always work like that. And Dennis, if you remember, now this I can talk about. My gravest concern is, if you remember, I did brain scans on him and a few of the other patients.
Correct.
And he had the stippling of his cortical surface associated with significant alcoholic liver damage. Alcoholic brain damage. And so that, as somebody that cares about this man, that has always been something I've been very, very concerned about, and bring up to him, not on a, whenever I can. But if he's drinking, that's concerning. And he certainly has a huge, one of the markers for alcoholism in some of the bigger studies, they try to figure out how you can, if you have somebody with, the classic study was done on sons of alcoholic fathers. And how do you predict who the sons are that are going to develop alcoholism? And resistance to alcohol intoxication was the numero uno marker. And so if you are somebody that can drink everybody under the table and have huge tolerance to alcohol, that's a problem. That's a marker.
If you're able to catch any of the new Surreal Life, you will understand what I'm saying.
Okay.
It's very disconcerting, and he has mentioned your name also.
In vain or in vain?
No, no. As someone who he has sought treatment from.
Yeah, and he's done well. And again, I am not presently doing that role for him in his life, and I've terminated that. And then we subsequently became friends, and I care what happens to him. He's got a
good guy.
He is a good guy, and he has many. Look, Rodney King is somebody I had massive affection for, and I'm still friendly with his family. Oh my
gosh, I know.
And Rodney, when he drank, was a horrific monster. He was terrible. And when he didn't drink, he was the kindest, one of the most amazing humans I know. And so it's this illness, it's this chemical. It messes people up, and it's sad when it does. So
last time we had him on our show, it was This Life You Live, #YouLive, with Bob Forrest.
Yep.
It was a good time.
And I told him then, I said, Sean, oh my gosh, I'm getting emotional just thinking about all this stuff. Dennis, I said, can you imagine somebody mentioning the words Dennis Rodman and Nobel Peace Prize in the same sentence? Because back when he was making the inroads to North Korea, that people would say silly things like that. But there we were. He has a whole group of peers looking after him. There's a lot of sober people pulling for Dennis, and when he does do well, he does very well. He really does. So let's talk to Daniel.
That's nice that she's worried about him.
Yeah, I get it. I saw a couple of little 2-second clips, and I thought to myself, when I was watching that. So, Daniel, what's going on there? You were unmuted, and now you're muted again. There you are. What's up? Oh, now he's muted again. He goes on and off. I hear him. I can hear the background noise.
Oh, here we go. All right. I'm sorry about that.
You bet. What's up?
Not much. Thanks for having me up.
You bet.
Question for you is, I am a former paramedic firefighter. Absolutely loved every aspect of medicine. Trauma is cool when you first get into it because it's blood, guts, and gore. But if you stick around long enough, you start to enjoy solving the medical puzzles, which involves a lot of analytical thought, logic, and it just, as someone who was in that world and absolutely loved it and loved everything about it, what would you say to a guy like me who really appreciated the logic that it took to get to a conclusive diagnosis and then treat the patient in a pre-hospital setting, and just watching that be blown to shit across the board throughout the COVID pandemic?
Right.
I mean, I really don't want to lose faith, I guess is what I'm saying. I'm hoping you can restore it. Give me some good news here.
The good news is that you are not alone, that I saw exactly what you're talking about. I still, I all the way through the pandemic, I was shaking my head in disbelief. Now I've progressed to where I look like my Australian shepherd who just turns his head and looks at me like I'm trying to make sense of what you're saying. I can't. So I feel like that's improvement, and I'm slowly putting together the pieces of what happened to us. There's still a couple concerns I have, like you. One is, like yourself, I thought my job was so important. Like, it was really an important job. And I feel like a lot of our peers sort of abandoned that in some sort of self-preservation, mass formation. Something happened that we need to really look at ourselves. But people are looking at it, and they are piecing it together. And I do believe there will be some sort of, if not a reckoning, at least an evaluation of how we cannot do this in the future. But it was extraordinary to watch. I am so with you on this. You need to go to medical school and become a surgeon. You sound like somebody that would be a great surgeon. I think you'd love that improvisational challenge of being in a surgical field and solving problems.
Quite the compliment. I appreciate that. Thank you, sir.
All right, man. Good luck. Stay with it. We'll get through this. We'll figure this out. It's again the new information I have as of today that came to me yesterday. And again, some of it was from reading this article on Springer Link. It's called Censorship and Suppression of COVID-19 Heterodoxy, Tactics and Counter Tactics. It was in an article called Minerva. It's an open access thing. It's not a peer-reviewed thing. It was just sort of a review of what happened. And the one thing that jumped out at me from this article was they make the point that almost all of the people that were severely canceled, I don't even have words for it anymore, the way their careers were disrupted and their reputations were destroyed. Those people whose names a lot of them now, but even the ones you don't know, virtually all of them were people of the highest academic standard with multi-decade years of clinical experience without a blemish on their record, and which, like Jay Bhattacharya or Aaron Kheriaty, who I interviewed yesterday, These are people at the highest post in their profession, maintaining the highest ethical and professional standards, teaching, helping patients for decades. It's hard to do that and not have any, they never took their foot off the accelerator in terms of the work they were doing. And all of a sudden they were taken down by a group. That's the article. Were taken down by a group who was using tactics, unfair smear and fear tactics consciously in an attempt to suppress their First Amendment privileges in order to have their way, to express their will, to make sure that their decision-making wasn't addressed or countered in any way or was open for further discussion. I understand there was a panic. I understand there was a lot of things going on at the time, but there were people who were raising their hand and saying, maybe there's something better we could do here. Why don't we talk about it? And those are the people that were summarily crushed. That's astonishing to me that we picked the best and brightest and with the highest professional standing and chose to totally destroy those people. It's you in science, those are the people you want to kind of listen to typically, even if they seem to have an outlying opinion. You want to make note, they had that opinion. Maybe they're onto something. I don't necessarily agree with it, but let me listen to what they have to say. The fact that it went the other way into this weird guillotine, this weird public execution, very bizarre, very bizarre. And this article that Caleb just put up there also highlights how these people responded, which is also kind of interesting to me. Everyone responded with shock. Like, what in what world do me just raising an issue result in this? It's shocking. They couldn't believe it. Then they went into sort of protest, trying to fight against it. So they, again, accelerated what they were saying. I actually remembered feeling like this when I was talking about the panic that the press was inducing. It's how you get into trouble right there, because you can become hubristic and start becoming adamant about your position as opposed to just evaluating it and trying to be reasonable. That was my error in the early phases of the pandemic. And they protested and they fought back. Then they were further marginalized, and some of them, maybe like me, said things that were excessive, but they then were pushed into alternative means with that. There we are. In an effort to silence alternative voices, widespread use was made not only of censorship, but of tactics of suppression that damage the reputation and careers of dissenting doctors and scientists, regardless of their academic or medical status, and regardless of their status prior to expressing a contrary position. There it is. It's crazy. And eventually what they had to do is find alternative means of expressing themselves. And it's sort of interesting that we created this platform for Dr. Kelly Victory to be a part of what I was doing. It was actually Susan's idea. I didn't think of it as creating an alternative platform for somebody who had been censored. I just thought she had interesting ideas and I wanted to hear interesting ideas. And she knew people who had alternative ideas. And I wondered if I could learn something from them. And now, of course, we both are being, there are extremists out there that call anyone that has any sort of dissenting opinion or even just raising their hand and asking for more data as anti-vax. You're an anti-vaxxer. And by the way, the great thing about my position is I get called by those people anti-vaxxers, and because I give my elderly patients the vaccine, I'm called a shill for Pfizer. So the critics agree, everybody. The critics agree. It's all over the map.
You can't make anyone
it's so
happy.
ridiculous.
You really can't.
Isn't it so ridiculous? It's so ridiculous.
Wow, it is so interesting.
Go ahead.
Yeah. No, they attack. It depends on.
You've been sitting here watching it.
I can sit here and I can be watching on Twitter while you're on the show, and they're attacking you from one angle because you're not promoting enough vaccines. Then I go over to Rumble and they're attacking you because you're promoting too many vaccines, and none of them are
right. And the fact that I use Paxlovid is a disaster. I took care of a COVID patient today, and I elected not to use Paxlovid. It was on the table. It was a maybe, but I thought, this person will probably get a rebound. He's doing pretty good with this. Let's not do it.
That rebound thing's no good.
Yeah. But isn't that crazy? I mean, you have guys
it makes your mouth taste terrible.
So, Caleb, I know you had concerns about Dr. Gorski's thing out there. I I like his reasoning. I think he's got an interesting point of view. I'm ready to listen to him. It's his rhetoric that it has to be so extreme and denigrating that I feel like, Susan, we used to talk to our kids and we would say, I can't hear you when you talk like that.
Yeah.
when you talk like that, I can't hear you.
I've been dealing with him for a long time.
It makes
so
it hard to hear.
I have my feelings.
Even though I've left the door open to talking to him, and he now can't speak to me because I spoke to Robert Kennedy. So what is that now?
He's too good for you.
This is the clip that we actually cut this clip and uploaded it like a few days before that.
And he's took an issue with
Twitter.
that?
He didn't. I don't even think he even saw it. He actually said in the thing that he wrote that he didn't actually watch more than a few minutes of any of the videos, and then he goes on Twitter and calls you an anti-vaxxer doc, which is the exact opposite.
But to be fair, he calls everybody an anti-vax. Anybody other than orthodoxy, which is 5 and above, 12 and above, get it, 5 and above, get it. Anybody goes, I don't know, I'm not sure. Anti-vax. And it's kind of interesting because I feel like he's been the object of the anti-vax.
We shouldn't even be giving him promotion.
Relax. The anti-vax world has been after him for a long time in horrible, horrible ways. And so I think he's like built this sort of immediate defensiveness to it that I can understand given what he's been through all these years, but it's missing a little bit of the nuance. And now he's going to get in trouble from being too hubristic if it turns out that there are some problems with this thing.
And he's attacking people that could be on his side. Like you've invited him to come and speak many times, but he just wants to go and attack you. I don't understand that. I don't understand why you can't work together.
People like this.
What
my theory? Okay, because I'm the social media person, as you are, Caleb. But I had to watch the thread at the beginning of the pandemic and watch him just go off on you and everybody else. Every time he would say something shitty, he'd get 50 more followers. And the guy tweets 1,000 times a day. That's all he does. He's not even practicing medicine. Like, I don't even know what he's doing, but he's on his phone like a teenager. And when you do that, you get more attention.
Supposedly, I thought of that too. He says he's a cancer surgeon, but when are you doing surgery if you're constantly
I mean, he's always
like
on his freaking phone.
It's really...
And honestly, he's been doing this for 3 years.
Weird to me. It's also weird to me that people get canceled by their employer for, I don't know, saying, sort of talking to Robert Kennedy or something, but he can go on the attack and say horrible things about other people, and his employer isn't concerned about that
all fucking day. But then he puts like pictures of puppies at pins it to the top. Oh, I had a litter of puppies today. Like he's some kind of a saint. It's like
you have strong feelings.
I've read a lot of his thread, and I think he's a douche canoe.
I don't have it. I don't have those feelings. Turbo, let's keep going. The negativity fuels people, Susan. It's pretty, and I don't think it's collegial, and I don't think it's right.
Oh, he's trying to get numbers and people to like him.
I really think physicians should talk to each other like colleagues.
That's my whole point. I don't understand why all the physicians can't work together. Like, you have a huge platform. Why wouldn't you want to come on the show?
Your job is to serve patients, not to be right. Your job is to serve patients, not to be crapping on your peers. Turbo, what's going on? I see you there, and you're not muted. Not quite sure where you are. Oh, gone. Oh, back, gone. He came and went. Let's bring Joshua up. See what's going on with Josh.
Hey, Dr. Drew.
Hey, man, what's happening?
Not much. I wanted to talk. Oh, hi, Susan.
What's up?
Not much. So I wanted to talk about what you were saying about mental illness, because you sort of struck a chord. And, I saw something you retweeted about how you can just be kind of an asshole, and maybe you don't have mental illness.
Right.
And I was wondering if you could talk about that and how one would come to know whether they have mental illness if they're prone because of their illness not to.
Not to what?
Not to know that they are sick.
Oh, that's a feature of the lack of insight, or anosognosia is a absolute feature of serious mental illness. Almost always.
Okay, so how would you come to know if you were not well?
Did you see the interview? That's anosognosia up there on the screen. Did you see the interview I did with? I'm blanking on his name, from New Orleans. He's a shoot. I'm so embarrassed that I can't remember his name. He's a professional now, and he had severe bipolar disorder.
Yes, I remember that.
Yeah, and he was, going to Quantica all the time and telling the FBI that he had special information. And he took him about, he said, 6 to 12 months before he realized how crazy that was. So you have to come down from the state, whatever it might be. And that usually requires medication. At the same time, the cognitive behavioral therapies, activating the frontal lateral prefrontal cortex regions to kind of be aware of what you're doing and to sort of reflect upon it, that tends to bring into awareness. Like, for instance, schizophrenics can be one of the reasons I'm crazed by all the schizophrenic on the street who are out there sick as hell and don't know it is early on. First of all, you can prevent the brain deterioration that happens with untreated schizophrenia, but you can teach them to become aware of what delusional thinking is. I've had schizophrenics say to me like, oh yeah, I thought yesterday the devil was trying to take my child, but I remembered that I learned that's my illness. Those are my delusions again. And they can step back from them as opposed to be overcome by them.
Yeah. So like you can even be a sort of a philosopher and the things you're doing aren't sort of like FBI, like, in other words, you can just be really smart.
Anytime you imagine unless there is some evidence, like you are a professor or you've got all A's in a philosophy degree or something, anything absent evidence where you feel you have special powers, special insight, special purpose, all that, be suspect. And we're seeing a lot of that from weed these days. Weed induces that kind of thinking, which is kind of tough. So people start, thinking these kinds of grandiose thoughts and not getting a lot done. That because they have special purpose and special insight, but no evidence.
Yeah. And I guess the reason why that would be mental illness is because you could get better than the state you're in is not, it's not feeding you the correct way. It's destroying you in some way.
So correct. So mental health is about being thriving, being as highly functional as you can, as something is getting in the way of your functioning, and B, being able to assess and accept reality on reality's terms. You're clear what reality is, you're accurate what reality is, and you accept what reality is, and your role in it. You're right-sized, your self-assessment is accurate. None of us are perfect with all this stuff, but just generally speaking, reality on reality's terms and good functioning. Okay, we'll go with that.
And what would you say about anger? I feel like anger is a part of this too, because if reality is causing you so much anger, it's almost like the anger itself is sort of
pathological.
Could make you sick. Yeah.
There can be pathological anger. Usually, hold on a second. Reticuli reminds me of Michael Crichton's thing. Thank you, reticuli. Anger usually makes people depressed. If the anger is sort of, it kind of goes anger, resentment, and then sort of mood off. But yes, anger is
because the anger is like internalized, right? I mean, we get angry at ourselves.
Yeah, you have to kind of anger has to be kind of expressed. It has to be, I'm not an expert in anger. I got to tell you, anger is sort of a little bit of probably because I'm not great at expressing anger myself, that anger doesn't get my attention that much. But I do know that people that have sort of unrepressed anger, the other thing is sometimes, gosh, now you're getting towards assholishness, for lack of a better word. Sometimes reality does kind of suck and you do get appropriate anger about it, but the issue becomes then, well, how do you express that anger and how do you deal with it productively? Is it productive to be an asshole and just act out that anger, or might there be better ways?
Yeah, and I guess loss and grief is attached to this, because sometimes we're angry when we should be grieving. Maybe there's some grief there that we're not dealing with, and the anger sort of covers it up in some way.
Yes, I agree. I agree wholeheartedly that anger is a part of grief, but you're making a bigger point here, which is that when the world isn't what we expected it to be, or we turn out not to be who we thought we were, we experience grief, and people fight that. They would rather blame.
It's like the worst thing in the world just to mourn a loss.
Particularly when that loss is who you thought you were. It'd be better just to get angry at the world than to feel that.
And a narcissist might be prone to this. I mean, 100%. Narcissism, we want to maintain our narcissistic perfect image.
100%.
And when it can happen just in old age. When someone gets older, they're not as attractive anymore.
100%.
And they might lose the attention they used to have. And this can cause sadness and anger.
Aging narcissism is not pretty. It's
but it's a chance to get help at that point.
Yeah, right? they have, you know what? I don't have a lot of enthusiasm for treating people over the age of like 65 or 70 because they're pretty fixed in their way. But maybe, you can say maybe there's opportunity for finding greater richness in your relationships by coming to terms with some of that stuff. Very good, Josh. Thank you so much.
My mom was a narcissist.
You're just realizing.
No, but she got dementia and forgot.
I forgot that she was a narcissist. Oh, it's funny. Oh my goodness. All right, let's kind of keep going here. All right, let's get Reptile up here, whatever that is. Let's see what Reptile is. Their name there? Nope.
Wait, I know that was a joke, Drew, but is that possible for like a narcissist
What's that?
Like a narcissist to become less of a narcissist because they forget about themselves in a way? Like, is that actually?
It's the answer is
better over time.
Oh yes, because in Alzheimer's dementia, particularly, the self dissolves, the self goes away, so there's no self to be narcissistic about, right?
Wow, that makes so much sense. I just never thought about it. Wow.
Yeah. Well, Susan experienced it.
It was a lot easier.
Yeah, she experienced it firsthand.
It's sad though.
Yeah. Okay, I'm trying to make decisions here about whether to keep. We got a few more guests. I got to try to bring up here. I'm going to try to bring. Did we have Sean up here? Let's try it again. Or was somebody I tried to bring up and couldn't bring up? Sean, did I have you up before, or I'm getting confused by the different names that are coming across my screen? Just unmute yourself there if you're still there. Let's see. Somebody's saying on Twitch, being a narcissist means you're constantly stuck on something that happened to you and it still affects you every day, like glorified self-loathing. Narcissists can get stuck on things, and that stuckness is usually resentment.
For sure.
Do I fast?
She had that.
I do not fast since I started a keto diet. Okay.
I lost 7 pounds.
Good.
Doing delayed gratification.
What does that mean?
What do they
Dieting?
call? Yeah, you don't eat till like 3 o'clock in the afternoon.
Yeah, that's the fasting thing we were just talking about.
Intermittent. I drink coffee during the day and then I
delayed gratification. I know that's an interesting concept for you.
I know.
Not something you're.
But I lost 7 pounds, so every day I go, not so bad.
Sean, are you there? I'm going to put you back if you don't unmute yourself. I'm going to go try to get a couple more people.
Yeah, he probably fell asleep.
Oh, is that you, Sean?
Yes. Hey, Dr. Drew, how are you?
What's happening?
Hey, man. Hey, I'm curious. I got a good buddy of mine who you were talking about COVID at the early part of this session here, and I've got a buddy. He's a long hauler, and he's been he's had remnants of this for it's going on. It's a year plus now.
Terrible.
I've got some clinical folks, clinical team that I work with, and I talk to them about it. And a nurse practitioner has suggested, maybe try having him try getting into a study, to get with kind of an infectious disease doc. And that was several months back. And is there anything else kind of leading edge that might be out there?
I mean, go check out covidlonghauler.com. They are having good results with a multiplicity of different kinds of therapeutic interventions. covidlonghauler.com.
Dr. Patterson just did a YouTube video on it too.
Dr. Patterson?
Yeah,
I didn't see it.
Dr.
Good.
Yeah.
Dr. Yogendra's over there. It's just covidlonghauler.com.
Don't they have like a YouTube channel or something?
covidlonghaulers.com. Apologize. They use some antivirals. They use they're using all kinds of funny things.
We should have them back.
And they're having good results. So they also are sort of nailing down the physiology a little bit and where the inflammation is going, which seems to be primarily in the brain. So it's a real thing, and it's nasty. And I've seen it from the vaccine and from the COVID. I've seen them both. Something about this spike protein. One of the theories is that the spike protein keeps persisting in these things called, I believe, non-classical monocytes, who normally go through a cell cycle and die. They are not going through their normal cycle, and they're staying in the central nervous system and causing some sort of inflammation. So that seems to be the thing. So covidlonghaulers.com. Reptile's applauding, so I'll bring
I wonder if
him
he has
up
links
here.
to his video.
Reptile, you dealing with long hauler stuff too? Who has links? Reptile?
That's a cool.
G'day.
There you are.
G'day, Dr. Drew.
Good day,
G'day
sir.
G'day from down under Australia, mate. I just want to say again, keep up the good fight. You've been doing some amazing work. And that interview with Robert F. Kennedy Jr. was absolutely brilliant. But I do have to ask you, mate, because especially when you're talking to guys like Robert F. Kennedy Jr. and so many other guys, I do have to ask respectfully why you would say that, and still recommend that people over 65 would take this thing, because I personally know people over 65 who have been damaged from this thing. And I think at this point, mate, I think we can safely say this is some sort of a bioweapon. And again, not that I know anything like you do, mate, but
so let me
should we really be injecting over 65s with this stuff, mate?
I understand if somebody didn't want it or a doctor didn't want to prescribe it. I totally understand. I totally get it. I am trying to walk a line between overreacting to some of the data that you're talking about and ignoring some of the benefits that have been derived, right? And also some of the benefits that I'm seeing, I'm actually seeing clinically without the adverse events that you're talking about, knowing full well that they happen. But the question is, it's a risk reward. This is the thing that's been missing in this whole damn worldwide mess we've been in, is people making good risk reward decisions. And so I'm trying to make a risk reward decision just yesterday for an 82-year-old with multiple medical problems who did well with the boost, who did well with the previous vaccine, who's had COVID. I'm trying to make a risk reward analysis for that person based on the concerns you have, because I've seen the same, I've done the interviews that you've seen, and the fact that billions of people have received this, and it seems like there's been some benefit. The question is, at what potential harm? And I'm trying to weigh that out against what I see every day in my clinical practice, where I'm not really seeing much in the 65 plus group. Remember, I was an enthusiast about Paxlovid at the beginning because I saw it just stopped the illness. Now I've seen a bunch of rebound where people were sick for 3 weeks, and maybe would have been sick for a week had I not used it. So our experience with these things does change with time. Again, enthusiast for Paxlovid still thinks it has a role, but I'm not prescribing it as much anymore because of my clinical experience. Maybe I will get to the point where I'll be objecting to any further boostering of my patients. I could see getting there pretty easily, because I'm not sure what we're doing just yet. But that's my thinking, my friend, and that's sort of where I have to leave it as a clinician, trying to do what's best for patients. I'm trying to do what's best. I really am. Let me quickly get. Let's see. Hold on a second. Oh my goodness, you guys are all new to me, and I'm trying to get somebody up here that I think you want to
get new people.
Okay, that's what I'm trying to do. This is MJ, I think. MJ, and then we got to kind of wrap this thing up. So, this is Michelle. I think this is going to be. There you are.
Hello, sir.
Hey there.
So, I would love to hear your advice for parents of an adult who is transitioning medically and does not really hear any of our concerns regarding how that can affect him medically. Also, the fact that he's not getting the past history of trauma dealt with, and most importantly, though, the issues of his rhetoric and argument of, he's right about everything.
Yeah.
So how do we keep that like love and friendship between us? Like, how do we not offend him?
Yeah, I know.
Because
it's hard. The good news is I do know lots of adults that transition that are thriving, and I believe was the right decision for them, and I support them fully. And so it's not as though this is something that you have to be afraid of necessarily. I understand what you're saying, and that the complete picture is not being managed, that as though managing this will manage everything. And so the way I look at complex cases like this is, gosh, I would approach it with a team like I would any other complicated medical psychiatric situation. If there's trauma, if there's need for medication, if there's major interpersonal issues with the family, I would get a primary care person and I would get a psychiatrist, and I'd put a team together from there. I'd get two people that everybody trusts, one on the mental health side and one on the medical side, and I would start piecing together a team that kept the best interest of the patient in mind as we got this whole thing sort of managed. And it could easily include the whole team to help with the transition, but boy, you sure want to not miss the trauma stuff, would you?
Right.
So if the family starts having issues, I would bring the family into the situation as well. Try to have some family dynamic therapy, but it's not easy. It is not easy. I understand. And anybody who, how can we say this? Whenever parents have concerns, and adults, children seem unable to see what's going on or to listen to the parents' concerns, it's often at the detriment of the patient, the child, because parents really have only the best interest of the individual in mind. And I think trying to get the identified patient to understand that can sort of soften things a little bit. Does that make sense?
For sure.
And I know in the meantime it's painful because you're sort of seen as outside or an enemy, or you're trying to impose your will or whatever it is, which of course you're not. You're just trying to make sure this person you love gets the best possible treatment.
Yeah.
Mm-hmm.
I have a question.
Yeah.
Do you think there's any substance use in this scenario included that you might have to address?
Oh, yes, there's that too.
Yeah. And
because that's like, you have to really make sure that that's not the problem.
Well,
it's
not only
between your communication.
Right. Because the cannabis and stimulants can really make it hard to have any sort of, particularly if you're hearing people saying, you're not hearing me, or you're accusing you of doing things you're not doing,
or projecting their own feelings on you.
Projecting their stuff on you. That's when you know that the substances sometimes support that kind of thinking. Okay.
Yeah, like that's probably the first thing you want to make sure you have somebody to
but again,
advise, like a psychologist.
Right. Well, that's why if you had a team, you had a primary care person and a psychiatrist, you could go to them and go, hey man, you're missing this piece. We need another team member here. We need a chemical dependency counselor, or we need a psychiatrist to address it, whatever it is. Because again, these are complicated situations, and leaving out, it's like if somebody had alcoholic liver disease. This is just for sake of conversation. And you start treating the liver disease, but leaving out the alcoholism. Well, that's not going to work. It's going to still create more problems down the line. So you have to treat the whole person. And unfortunately and this is not me saying that people that have want to transition, have gender identity that identifies a separate gender, have to see a psychiatrist. I'm not saying that. I'm not saying that there are other issues necessarily. This caller told me there are other issues. It's a complicated situation, and these things are being missed. And that is a deeply unfortunate situation when the whole person is not treated. That's all I'm saying.
I think that doctors should make you go through a mental health, survey before, and ask if you use drugs, before they say yes to, sure, let's change your gender. Like what they should do, like a history on that, and say, are they ready for this?
It's given the way the care of transgender patients is so fragmented, that becomes really hard.
Yeah.
It becomes really hard. But ideally, of course, you'd want everybody with any treatment of anything to get the whole person treated. But it's a very odd thing going on right now, where you're not allowed to bring up other issues to the team that's treating the gender part. So it seems problem. You can be, I believe it is possible to be gender affirming and treat the whole person. That's possible. That's not an impossibility. It's quite possible. Okay, well, we got to wrap things up. These are very interesting, complicated calls we're getting.
We wish you all the luck.
Yeah, and absolutely. We want your. Did you say it was the son to daughter? Daughter.
Yes.
Was
Male to
we want
female.
we want her to thrive in the world, to have a great life. That's all that matters. That's all I think most people want. And the fact that some people are called, I did an interview with a guy named Jamie Kilstein for After Dark, and he was telling me how he was one of these trolling assholes who thought everyone that didn't see the political landscape the way he did was a horrible person, a bad person, needed to be destroyed. And then something awful happened to him that humbled him, and he realized, oh, we all just want what's best for our family and each other, and we just have different ideas about getting there. But it's not because they're good people and bad people. It's because we just have differing opinions about how to get there, and we could probably share opinions. This is again back to like how the science should be shared and debating and finding the route to the best possible outcome, the closest proximity to the truth, the best thing for people. The people that feel other than that are pathological. If you're convinced that everybody is out there to harm other people, it's just not so. I mean, go out there and meet people. I'm not saying there isn't evil. I'm not saying there aren't bad people. There are. But that's a very small number, and the rest of us need to get together on a middle ground. That's all I'm saying. Okay, so let's see what you guys are saying. Yeah,
you want to end it on something cute here? This is my the latest photo of
Your
Something
baby?
happy.
my baby. This is him at the
There
puppy
he
pad.
is.
Oh my God.
He is walking.
And his adorable
now.
wife.
He loves
Oh
walking,
my.
getting into everything. He likes, I made the
Course.
mistake of being silly. And so I took like one of his toys and I put it in my mouth like this, or I made him laugh. Now he does that with everything. He's got to take everything in his mouth. He goes,
Don't laugh.
Get me to laugh now. And now I'm like, I can't joke
Oh my
about it. I
God.
can't laugh. Look at this little kid. Look, I'll show you. Here's the other one.
Fantastic.
Look at his cute wife, though.
Mhm.
Adorable.
Beautiful, the best.
He's a good boy.
Yeah, it's
Um,
she's a Pilates trainer. So,
Before we went,
Yeah,
before
I
we
can't do that.
We finish. People are making some good
I'll fall right back on
recommendations
my
on Restream. Somebody said you can always make an anonymous message to the surgeon or the transition team about concerns of substance use. That is true.
True.
You can always. They may not be willing to talk to you, but you can always give your evidence. Tell the doctors the evidence, even if it's just. If it's just anonymous on a phone message or something, or an email, whatever it might be. Let's see.
Jehep likes his wife.
Jehep likes his. Oh yeah.
I'll tell her.
Okay.
He's very
Everybody
transparent.
Jehep also wrote a song for you, Susan, for me called "Fart in My Face." You have to listen to After Dark to understand what that's all about.
Yeah.
Again.
Yeah, that was a hard question to end on because
Because they're complicated and it's filled with lots of unpleasant feelings, and people feel unsupported if you treat them at other.
I mean, Paulina had substance abuse problems over the years, and we had to tiptoe around her, and she got into some crazy, escapades, and we just had to sit and wait and watch, and now she's sober and it seems better, but she's also doing better as far as seeing things that are not so good for her.
Yeah. And grateful for her recovery, and it takes what it takes. We don't have control over our loved ones' conditions, particularly when it comes to substances.
So that's why I asked, because
if you have leverage, you can't get them to good care, though.
When communication stops, sometimes there's other reasons. So, if they're not listening to your advice because they've sort of blocked it out with drugs.
All right,
Mostly
guys,
pot.
I'm sort of out of steam myself, so I apologize if I'm sort of running out of enthusiasm here. It's because I'm tired. So we're going to wrap this up. We are going to be in here tomorrow at noon or 1 o'clock. 1 o'clock. 1 o'clock with
Clifton Duncan.
Clifton Duncan, who is, I do recommend him as a follow on Twitter. He's been on fire lately. He's been
I've
so
wanted
funny.
him back for a long time, but now he's proving me right as a good guest.
Susan likes Clifton. I saw him give a speech, and I just said, "What that guy? I need to talk to him."
I know.
And he has continued. He said something very interesting back when I last interviewed him. He said, he was an up and coming actor on Broadway and really very successful. And because he wouldn't take the vaccine, he was vilified by his peers, vilified and unfairly cast out, ended up working in a restaurant down in the South, and is now being sort of encouraged to go back to doing the work on Broadway. And his position has been, why do I want to work with those people again?
Fuck you.
Why would I want to work with the people that treated me like that, behaved like that were so discriminatory? They've shown themselves who they are. I don't really want to be around them anymore.
We had this conversation on Rumble yesterday with one of the people there. I think it was it Molten Salt? But he or she said that they didn't get the vaccine and the neighborhood turned against them and wouldn't allow their kids to come around.
Yep.
And now they're starting to come back around and they're like,
they're starting to talk to them
don't
again.
Don't really want to. But
we've seen who you are. We've seen that you are discriminatory.
Exact same thing.
Discriminatory, mass formation prone, people who don't care about others and are prone to being swept into panics where you harm people. And that's maybe somebody that's not safe to be around. I don't know. It's interesting. Personally, I'm ready to get in with everybody again and try to get everybody back on track. I think they were all victimized by our government and by our media, and I blame them. Those are the people I blame, and because I blame them, I want to get into those mediums, meaning particularly the media itself, like we're doing here, and change it. That's always my instinct, is to get into it and change it, move it in a good direction. So that's where I'm at with it. All right, everybody, thank you so much. Again, 1 o'clock tomorrow, Clifton Duncan, rather. And then we are away. I guess we'll be here Monday and Tuesday.
We have a show on Monday.
Monday and Tuesday.
It might just be questions. I don't think we have a guest, but on Tuesday we have a guest.
Ed Dowd coming back on Tuesday.
Yes, we're going to bring back Ed. We're doing some repeats this week because we like these guys. And
we want an update. We need an update.
We're leaving the country for 2 weeks until the day after Thanksgiving, when we will come back and have hopefully a really great guest.
We have a possible big
surprise.
Surprise.
We're not gonna say it.
We can't say yet, but we have a maybe big surprise the day after Thanksgiving that you will all enjoy. So don't forget us. We'll be there. And we'll see you tomorrow with Clifton Duncan at 1 o'clock. See you then. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.